And welcome to today's Better Breathers Network webcast on the state of the air and protecting yourself from unhealthy air quality. My name is Nicole Goldsboro, National Manager of Lung Disease Programs, and I'm here today with Katherine Pruitt, American Lung Association and National Senior Director for Policy, and she will also be our featured speaker. So before we get started and I turn it over to Katherine, I just wanted to share a little bit about the American Lung Association. So for over 115 years, the American Lung Association has been a champion for clean air for everyone, with a mission to save lives by improving lung health and preventing lung disease. And we achieve our mission every day through education, advocacy, and research. And just a reminder, before we dive deeper into our presentation, it is important to always consult your healthcare provider or personal physician with any questions you have regarding your specific medical condition or information that you've heard on today's recording. So now it's my pleasure to introduce today's speaker, Katherine Pruitt. Again, is the National Senior Director for Policy at the American Lung Association. Katherine has worn many hats since joining the American Lung Association over 25 years ago. She started her career with the organization working on environmental health in the health education department. And since that time, she has overseen a wide range of national health education, policy, and systems change initiatives on healthy air, asthma, chronic lung disease, and tobacco control. Katherine currently directs the national policies initiatives on outdoor and indoor air quality and serves as the project lead for the American Lung Association's annual report, State of the Air. In addition to her work on environmental health and lung disease, Katherine has extensive experience with strategic planning, partnership building, health equity, and risk communication. And now I will turn it over to Katherine.
Thank you, Nicole. It's my pleasure to speak to all of you today on this important topic. On today's webinar, I'll be addressing the following questions. What is State of the Air and why do we publish it? What do you need to know about air pollution? What's in the 2022 State of the Air report? How can you protect yourselves? What can you do to protect yourself? And what can you do to help clean up the air in your community? State of the Air is the Lung Association's longest running and most widely recognized report. This past April, we released our 23rd annual edition. I think State of the Air has had such staying power because it provides the public, the media, and decision makers information about the air quality in their local communities and how it compares to other places. We focus on the two most widespread and important pollutants, fine particle pollution and ozone. And we use grades and rankings to present the data in an easy to understand format. We know State of the Air is an important, trusted resource because we see it cited in the media every day of the year whenever local air quality is being discussed. At the American Lung Association, we're firm believers that knowledge is power. That's why we've organized the Better Breathers Network, and that's why we publish our signature reports, including State of the Air. Giving people information about the quality of the air they're breathing is important for three reasons. So people can know how to protect themselves from unhealthy air, to give individuals information about how they can make a difference in their community, and to promote programs and policies that we know reduce air pollution and protect public health. Let's talk for a few minutes about air pollution and why it's a threat to health. There was a really good reason the Clean Air Act was passed with bipartisan support in 1970. Some of you probably remember, as I do, when our air looked like this in many places around the country. The air pollution was palpable. It smelled bad. It stung your eyes and throat, and it sometimes killed people in waves. Fortunately, the Clean Air Act has been one of the most successful pieces of environmental legislation in our nation's history. It has worked remarkably well over 50 years to clean up the air, and we've been able to track that progress for the last 20 plus years in the State of the Air report. But in spite of the progress that we've made on cleaning up the nation's air, our last State of the Air report found that more than 40% of Americans, over 137 million people, are living in places with unhealthy levels of particle pollution or ozone. Some places, like Los Angeles and Pittsburgh, to name just two whose air pollution problems you're probably familiar with, are still working to address a long legacy of pollution from industrial and motor vehicle sources. But unfortunately, we're also seeing an increase in pollution driven by climate change. Excess heat and drought are worsening both particle pollution and ozone, especially in the western US. If you or a loved one is living with a lung disease, you're probably aware that air pollution affects the lungs, causing wheezing and coughing, shortness of breath, and worsening of asthma and COPD symptoms. Particle pollution also causes lung cancer. But the more researchers learn about the health effects of air pollution, the more they learn about how it damages many other systems of the body. It can also kill people. Air pollution is bad for everyone's health, but some groups are at greater risk of health harm than others. Vulnerable groups like children, older adults, and people living with chronic lung disease and other health conditions are less able to fend off or repair the damage that air pollution can cause. Other groups are more likely to be exposed to high levels of air pollution because of where they live or how much time they spend outdoors. As I mentioned earlier, State of the Air reports on two of the most widespread and dangerous forms of air pollution, particle pollution and ozone. Let me tell you a bit more about both of them. Particle pollution refers to a mixture of tiny bits of solids and liquids in the air we breathe. Sources of particle pollution include motor vehicles, factories, power plants, construction equipment, wood burning, and wildfires. This deadly pollutant also goes by the names particulate matter, or PM, and fine particles. The particle pollution we cover in State of the Air is called PM 2.5, referring to their size of 2.5 microns or less in diameter. These microscopic particles are so small that they can be inhaled deeply into the lungs, where they can pass through the alveolar walls and enter directly into the bloodstream. Researchers estimate that PM 2.5 is responsible for nearly 48,000 premature deaths in the United States every year, as well as asthma attacks, heart attack and stroke, and lung cancer. Exposure to particle pollution has also been linked to increased likelihood of developing diabetes, Parkinson's disease, dementia, and poor birth outcomes, including premature birth, low birth weight, and stillbirth. Ozone air pollution is a highly reactive gas, sometimes called smog. It forms in the atmosphere through a chemical reaction in which the pollutants nitrogen oxides, or NOx, and volatile organic compounds, or VOCs, cook together in the presence of heat and sunlight. Fuel combustion in motor vehicles, boilers and engines in power plants and industries, oil and gas wells, vapors from gasoline, chemical solvents, and consumer products are some of the many sources of NOx and VOC emissions. Sometimes we refer to ozone pollution as ground level ozone to distinguish it from the naturally occurring ozone layer way up in the stratosphere, which protects the Earth from harmful exposure to ultraviolet radiation. We like to say that breathing in ozone is like getting a sunburn in the lungs. The caustic gas reacts with the delicate linings of your airways, causing inflammation and other damage that can impact multiple body systems. Ozone exposure can also shorten lives. Each year, State of the Air reports on air quality using the most recent 3 years of quality assured monitoring data from EPA. So the 2022 report includes data from 2018, 2019, and 2020. As I mentioned earlier, over the 20 plus years of the report, as the Clean Air Act has done its work to clean up sources of industrial and motor vehicle pollution, the air has gotten cleaner. But that began to change a few years ago as the pollution driven by climate change started to outpace the progress we've been making. This year, we found that nearly 9 million more people were impacted by deadly particle pollution than was reported last year. There were more days with very unhealthy and hazardous air quality than ever before in the history of this report. In all, over 137 million people live with unhealthy levels of air pollution. And the burden of living with polluted air is not equally shared. People of color are significantly more likely to be exposed to unhealthy levels of particle pollution and ozone than white people. State of the Air tracks two different measures of fine particle pollution: daily spikes, or short term, and annual averages. This year's report found that more than 63 million people in 96 counties were exposed to unhealthy spikes in short term particle pollution. Most of the places we track got worse, including 17 of the 25 most polluted cities. 8 cities hit their highest weighted average number of days on record. The increase in number, size, and duration of wildfires is largely responsible for worsening particle pollution, making it more and more of a Western problem. In State of the Air 2022, all but one of the 25 worst cities for short term particle pollution was in the West. Pittsburgh was the only Eastern city on that list. Ozone pollution remains the most widespread of the pollutants we track in State of the Air. More than 122 million people in 156 counties across the country are living with unhealthy levels of ozone. For now, at least, ozone pollution levels are moving in the right direction. That's down. About 1 million fewer people were exposed to unhealthy levels of ozone in this year's report compared to last year, continuing a trend we've seen in each of the last 4 years. 6 of the 25 worst cities for ozone saw their lowest levels ever, but that's still a lot of unhealthy air days. Los Angeles, which has held the top spot on the worst 25 list for all but one of the 23 years we've been doing this State of the Air, had an average of 180 days a year of bad ozone. That's over half a year. So, how can you use State of the Air to learn more about the state of your air? You can find all the information you need on our website at lung.org/SOTA. In that top banner of the report landing page at lung.org/SOTA, you can either select your state or type in a zip code. Clicking on a state gets you information for all the counties in that state. A zip code will take you right to the appropriate county page. When you get to your county page, you'll see something like this 2022 report card for Harford County, Maryland, a county in the DC Baltimore metro area. The 3 grades that we give in State of the Air are shown right at the top. You can see that Harford County got an F for ozone, an A for short-term particle pollution, and a passing grade for year-round levels of particle pollution. Note the 2 tabs on this page. The county, which is circled there, is on the left. And if that county is part of a metro area, like Harford County is, you'll see a tab on the right that will take you to a metro area page. Not all counties have grades, And that's mainly because not all counties have monitors to measure their air quality. Only about a third of all U.S. counties have any air quality monitor, meaning that two-thirds will not have any grades in state of the air. EPA and the states decide where monitors are placed based on where they think they'll get the most meaningful data for managing air pollution. If there's no monitor for a pollutant in your county, you will see DNC for did not collect, where that grade should be. Sometimes you'll see INC for incomplete, meaning there was a problem with the data sometime during the 3 years we cover in the report. And so there may be data for that county next year. So what can you do? Well, most of you probably live someplace that has some bad air days for either particle pollution or ozone or both. Especially if you or a loved one is in a high risk group, it's a good idea to plan ahead so you're prepared to protect yourself. Talk to your doctor about any adjustments you might need to make to your disease management plan when the air quality is bad. And be sure you have the medications you'll need on hand. If you live in an area at risk of wildfires, there's some extra preparations you should make to be ready for smoky conditions. Know how you'll get alerts and health warnings if there's a fire in your area. Set up a clean room in your home so you'll have a smoke-free place to retreat to if needed. The Lung Association's website has information on how to do that. Keep a supply of N95 masks on hand. Cloth masks do not provide a good enough filter to protect you from smoke. And if you use oxygen, get on your electricity provider's priority list for restoring power after an outage. You can visit lung.org/wildfire for more information. There also are some things that you should know about how to best protect yourself on bad air days. Keep an eye on the daily air pollution forecast in your area. If you're especially sensitive to air pollution, you may need to be taking some precautions on yellow days, or you may be fine unless the forecast is for an orange or red day or worse. Pay attention to your symptoms and learn to make adjustments as needed. And keep in mind that sometimes it can take hours or even a day or two after an exposure to air pollution to feel the effects. Avoid exercising outdoors on bad air days. Stay indoors with doors and windows shut, as long as as long as you're not at risk of overheating in a closed up apartment, because that's just as bad. Run your home and car air conditioning on recirculate. Keep other pollutants like secondhand smoke, and cleaning products out of the house to reduce the stress on your lungs and body. There also are some things you can do, and we hope you will, to help clean up the air in your community. On a personal level, the more you can do to reduce your contribution to air pollution, the better. You've heard some of these things for years, but they still make a difference. If you have a choice, opt for clean, renewable electricity for both your home and your car. Drive less. Don't burn stuff. All types of combustion produces air pollution. You can also sign our State of the Air petition asking EPA to set more protective air pollution standards. And please join our Lung Action Network if you haven't already to get periodic email updates on important opportunities to contact your elected officials and other key decision makers about vital lung health issues, including air quality. Now I'm going to turn the presentation back over to Nicole, who has some additional resources to share with you.
Thank you, Catherine, for walking us through the state of the air, as well as sharing your tips to protect and prepare for bad air quality days. As Catherine mentioned, I just wanted to talk us through some of the resources from the American Lung Association, and then we'll turn it over to Q&A. So if you have not already, as Catherine mentioned, there were several resources that she listed, such as lung.org/. SOTA for the state of the air, as well as lung.org/wildfires. And I'll also put those into the chat so you can take a look at it. But if you haven't visited our landing page at lung.org, there's a whole host of information available surrounding lung disease management, improving your lung health, as well as understanding natural disasters and handling emergencies related to poor outdoor air quality. So please take a look at the website for a lot of information. We also have several online communities through Inspire. These online communities offer support where you can talk to others who are kind of going through the same lung disease or same concerns that you may have. And we have 11 online communities, and you can find and learn more about them at lung.org/community. The Lung Helpline is a free resource offered through the American Lung Association, and you can speak to a lung disease or a lung health professional, such as a respiratory therapist, a registered nurse, or a tobacco cessation specialist, and learn tips and strategies and ask questions about how to handle handle lung disease management, as well as ask any of your lung health questions. We also have several videos available on YouTube, and so I would encourage you to take a look at some of these videos. We have videos on deep breathing, videos on a lot of our lung disease management tips and techniques. So take a look at our YouTube. And lastly, if you have not had a chance to join the Better Breathers Network, you can learn more about the program at lung.org/BBN. And this is a free program, and it's really designed to connect you with management tools and resources and virtual support programs like the one today. And so what I will do is I will stop the recording and we can get into the Q&A.